Susan LaFlesche, who was born on June 17, 1865, became the first American Indian woman to obtain a medical degree and practice medicine. Susan's father, Chief Joseph LaFlesche of the Omaha tribe, also known as Iron Eye, was the youngest of 4 daughters. Mixed-race parents, Wau Winchacha, also known as Mary Gale, and Chief LaFlesche brought up their kids to respect both Native American and European cultures. Susan commenced her education at a mission school located on the reservation at an early age. At these schools, Native children were instructed in the customs and behaviors of white culture. This process of assimilation, which was endorsed by Susan's parents, was not unfamiliar to the Omaha tribe. Chief Big Elk, the previous leader, had been advocating since the late 1830s for adaptation to the ways of the white world. Before his passing, Chief Big Elk designated Chief LaFlesche to continue spreading this message. Susan's father had received his education in St. Louis and was taken in by Chief Big Elk upon his return to the Nebraska reservation. While Susan's parents imparted to her the native traditions and heritage of the tribe, they refrained from bestowing upon her an Omaha tribal name or any tribal markings. While residing on the reservation, Susan encountered substandard living conditions. During this time, she witnessed the tragic death of another Native woman when a white doctor declined to provide medical care. Such experiences would shape LaFlesche's path toward a career in the medical field. Before going back to the reservation in 1882, she taught at the agency school for 2 years at the Elizabeth Institute in New Jersey. In 1884, she resumed her education at the Hampton Institute in Virginia for an additional 2 years. She was urged to seek for a scholarship from the U.S. Office of Indian Affairs while she was there. While other female graduates were encouraged to return to their reservations to marry Christian men, Susan seized her scholarship opportunity and enrolled at the Woman's Medical College of Pennsylvania. During the late 1800s, it was one of the few medical schools on the East Coast that admitted women as students. She studied obstetrics, anatomy, histology, general medicine, chemistry, and pharmaceutical science there. LaFlesche excelled in the Philadelphia school, winning the title of valedictorian and graduating at the top of her class on March 14, 1889, despite encountering bigotry because of her Native American heritage and gender bias against women in higher education. Following her graduation, she completed a year-long internship in Pennsylvania. After that, Susan started working as the attending physician at the government boarding school on her Omaha reserve. In this position, she was tasked with educating students about hygiene and frequently provided care for other members of the community beyond the school grounds. Additionally, she assisted fellow tribal members with writing letters and translating official documents. Her exceptional skills and compassionate care quickly earned her the trust and preference of the reservation's inhabitants, prompting her white counterpart to resign, leaving Susan as the sole doctor for an area spanning over 1,300 square miles. For several years, Susan traveled on foot, enduring the harsh Nebraska weather to make house calls. Later, she transitioned to traveling by horseback and buggy. Despite her extensive education and unwavering commitment to aiding the sick within the tribe, some individuals rejected her diagnoses due to tensions stemming from her father's influence, which had caused a division among the Omaha people regarding assimilation. Throughout this time, Susan received a meager annual salary of $500 and was compelled to purchase her own medical supplies when the Bureau of Indian Affairs faced shortages. She also received an additional $250 from the Women's National Indian Association for her contributions as a medical missionary. In 1893, Susan's demanding schedule attending to the medical needs of the tribe took its toll, resulting in her being bedridden for 2 months after a fall from a horse. In 1894, she wed South Dakota Sioux Henry Picotte, and they relocated to Bancroft, Nebraska. There, Susan established a private medical practice, and the couple welcomed 2 sons, Carol in 1895 and Pierre in 1896. Susan broke the societal norm of women staying home to raise children, opting to continue her medical practice in Bancroft, where she served both white and Native American patients. Her husband's struggles with alcoholism, coupled with widespread alcohol abuse among her tribe, prompted her involvement in the temperance movement. Henry passed away in 1905, and in 1906, Susan spearheaded a delegation to the nation's capital to advocate for the prohibition of alcohol on Indian lands. However, she stirred controversy with her support of the peyote religion, a Native American spiritual movement advocating for the incorporation of the hallucinogenic drug peyote into their religious practices. Following her husband's passing, Susan dedicated the next few years to a legal battle with the Bureau of Indian Affairs to demonstrate her capability to manage her late husband's estate over her brother-in-law. The estate, which consisted of approximately 185 acres of land in South Dakota intended for their 2 sons, was at stake. Once Susan prevailed in the dispute, she acted on behalf of her sons, wisely investing funds from the estate and proceeds from the land sale into rental properties. The income generated from these investments helped sustain her family financially. In 1910, Susan returned to Washington, D.C., this time to advocate before the Office of Indian Affairs. She argued that although many Omaha tribesmen possessed the ability to handle their own affairs, the Indian Office had hindered their development of business skills and assimilation into white culture. Consequently, some tribes remained vulnerable to fraud and relied on the federal government as their guardian. Susan's opposition to consolidating the Omaha and Winnebago tribes influenced this strategy. Susan Flesche Picotte continued her dedicated work with the tribe and realized her vision of establishing a reservation hospital in 1913, located in Walthill, Nebraska. However, her health had begun to decline, and she ultimately passed away on September 15, 1915, likely due to bone cancer. She was laid to rest in Bancroft Cemetery, alongside her parents, sisters, and older half-brother, Francis Flesche, a renowned Native American ethnologist, anthropologist, and musicologist known for his studies on Omaha and Osage culture. Her son Carol served in World War II and eventually settled in Detroit, Michigan.